So Durga Puja, middle of the night, the day of Vijayadashmi, at about 12 o'clock in the night, 12:30 in the night, there was a 56-year-old gentleman who came with severe chest pain. And presented with diaphoresis, sweating, uneasiness. When he came to the ER, his heart rate was dipping, blood pressure was fluctuating, and at that point of time, luckily enough, we were there in the hospital doing another case. We saw the ECG, rushed him to the cath lab. There we found out that there was an artery which was 100% blocked on the right side. There was an artery which was 99% blocked on the left side. He did not have any conventional risk factors. He was not a smoker, not an alcoholic. He was not hypertensive, not a diabetic. Still, he had what we term as a massive heart attack. Along with the heart attack, he also had a major hit to the conduction system of the heart. So we had to put a temporary pacemaker. The temporary pacemaker was with him, and then we opened up the right artery by suctioning, ballooning and stenting. And at that point of time, the heart rate still did not recover. After 48 hours of struggle, the temporary pacemaker was pulled out, his heart rate recovered, and now he's doing well.
We were in a party on Saturday night, being the Diwali season. We had a get together with our cousins, and my husband was doing fine when we reached there, but after an hour or so he became a little uneasy. So we realized that even though he was winning in the cards, he just got up and went to the balcony, which is rather strange for a person who's winning. And then he comes back inside and sits on the sofa. He looked uncomfortable. We all looked at him and we asked him, "Are you okay?" He said he was feeling some pain. So we rushed to him and we saw he was sweating. There was a lot of sweat on his forehead, and he said his left arm had started hurting also. So we became very concerned, and we tried to figure out some people said, can it be gas or something? But the way he was sweating and the way his left arm was hurting, because we've always heard that if the left arm is hurting, it is not a good sign. And the way his face was, we could make out it is not gas or anything. So we immediately decided to rush him to the hospital. And my mama was there. He was carrying a sorbitrate. So we quickly put a sorbitrate under his tongue. And we rushed him to Paras Hospital, which was the closest. And as we entered the emergency, they immediately took charge of him and they checked his blood pressure, they checked his ECG, and the ECG was all haywire. So I asked them what it was, and they said it's a heart attack. And so I asked him, how bad is it? They said it was really bad. So I said, now what are we going to do? It is 12 o'clock in the night. They said they made an announcement in their own technical terms, and which sent a call out to all the concerned that there is an emergency case of heart attack. And lucky for us, the cardiologist was right there in the hospital at that time. So within minutes, the cardiologist rushed down. He looked at the ECG and he said it's a bad attack, and we really need to rush him to the procedure, and we need to do an angiography. So they rushed him to the OT, and there they performed the angiography. And then the doctor called me and he showed me the blockages. So one artery was completely blocked, and from the left artery, out of the two, the second artery on the left was also blocked 99%. So out of two arteries were blocked, which were at a percentage of 99 and 100%, which was really huge. So doctor said it's a very bad case and we need to put a stent immediately. We need to do ballooning, and during the procedure, we will decide if we can put a stent in both the arteries or if putting in one artery, depending on how well the patient is taking it. Like my doctor informed me, his heart rate was dipping, and they decided that it would be right to just put the stent in one artery, which was the main culprit artery, and then we are going to wait for a few weeks to attend to the other blockage. So the doctor did an amazing job. Dr. Amit Bhushan Sharma was there, and he was like a God sent angel for us, and he performed a brilliant job. He did the angioplasty, and then he did the ballooning, and he's put in a stent over there. Then he called us and he showed us the difference in the artery and the passage before and after, and it was a miraculous change which was so visible. We could easily see what was going on inside earlier, and now how beautifully he had opened up the entire passage. So everything worked out really well, and my angels and my God has been very kind, because we were able to complete everything in an hour's time, where the ballooning was done as well. And thankfully for me, my husband is now doing very well. It's been 48 hours, and the pacemaker has been removed, and the heart is responding well. So we are hoping for the best now. So this has been the journey for me for the past 48 hours. Thank you.